Welcome to our special webinar on lessons for leaders on the US government's handling of the COVID-19 pandemic in the year 2020 and some of the takeaways that we can derive from that phenomenon. Now, let me say that at the Logos Consulting Group and our Logos Institute for Crisis Management and Executive Leadership, we study the patterns of crises, we study the dynamics of crises, and we try to harvest lessons that allow us to share with other leaders the patterns of crises that we know help get through a crisis better, and the patterns of crises that we know cause an organization and its leaders to get through the crisis worse than they otherwise would. And we typically study the biggest crises we can in order to be able to harvest the most lessons we can, and then be able to apply those lessons to smaller institutions and smaller crises. And that's what I'm hoping we can continue to do today. The mission of the Logos Consulting Group and our affiliated entities, including the Logos Learning Center, which you are now attending, is to build a better world by equipping people to become leaders who ignite and inspire change in the world for good, and helping leaders better navigate the most difficult challenges in their careers and often in their lives is one of the ways that we attempt to fulfill that mission. I am your primary faculty member today. You'll be hearing from me more than anyone else. Let me advise you before we move forward that this session is being recorded, and either all or part of what is being recorded may appear in various forms, including social media and on the Logos website. So be advised of that, and we assume that you're continuing to participate is your assent to this being recorded. By way of introduction, for those whom I've not had the opportunity to meet before, I am Fred Garcia. I am the president of Logos Consulting Group. I'm in my 40th year helping organizations and their leaders manage high stakes situations and come out the other side better than they otherwise would have. In addition to the work that I and my colleagues at the Logos Consulting Group do with clients, all of us also teach in a number of settings. In my case, I am in my 33rd year on the New York University faculty, and there I teach in the Stern School of Business Executive MBA program, a seminar in crisis management for executives. I'm also on the faculty of the Masters in Risk Management, and I teach a course on crisis management as part of risk management. And in the NYU School of Professional Studies, I teach a course on crisis communication in the Masters in Public Relations and Corporate Communication program. I'm also on the faculty of the Graduate School of Engineering at Columbia University, where I teach ethics and crisis and leadership. In addition to the teaching that I and my colleagues do, we also write and publish books. And much of the content that I'm going to share today, especially the content around best practices in crisis response and crisis readiness, I published over dozens of years in 5 different books. The first of which was Crisis Communication, which was published in 1998. The next of which was Reputation Management, the first edition of which was published in 2007. It is now in the 4th edition. I also published The Power of Communication, which is for leaders on how to maintain trust in high-stakes situations. But most of what we're going to cover today is from our book, published by the Logos Institute Press, called The Agony of Decision: Mental Readiness and Leadership in a Crisis. And I say all of that simply to underscore that the principles we're going to be teaching today are principles that we developed long before the COVID-19 pandemic. And one of the big takeaways that I hope you can derive from what we're going to be experiencing together today is this simple idea. Crisis management works, and it is a discipline that leaders need to take seriously. And when leaders fail to take seriously the crisis management discipline, they put themselves and they put their organizations and the people who rely on those organizations at great risk. And one of the disciplines of effective crisis management is to take those risks seriously. That is the single biggest takeaway of all we're going to cover today. And as we proceed in our program, I hope you will find opportunities to notice the difference of leaders and organizations that take risks seriously and leaders and organizations that fail to take risks seriously. In our journey over the next 80 minutes or so, we're going to cover three things. The first is foundational principles of crisis response, and that will establish the context in which to evaluate the 2020 United States response to COVID-19, the phenomenon, and the pandemic. And we will apply those foundational principles to the response and see that failure to take those principles seriously can have profound consequences. And then finally, we will underscore some of the lessons learned to help us and to help others do an even better job in the future in protecting their stakeholders, protecting their reputation, and protecting the other measures of competitive advantage that matter to them. Along the way, I may ask you questions, and feel free to respond by typing in the chat. Katie of our team will be monitoring the chat and responding. She's also making sure that, to the degree a human being can, our technology continues to work effectively. You can also, when I ask questions, feel free to unmute and contribute and speak to me and to your colleagues. Be advised that we are recording, and be aware that you are doing this as we are recording. If you have questions, feel free to type them in the chat, and Katie will curate the questions in the chat, and episodically I will invite her to share with me whether there are questions, and she will also exercise her judgment knowing what the sequence of our content is. If she knows that I'm about to address what was asked, she may defer asking the question, but she will also know where is a good point to reach out and interrupt me verbally so that I can take your question. So feel free to be in interaction with Katie and then to be in interaction with me. And Katie, I see somebody in the waiting room. You may just want to take a look there. Thank you. So with that, let's begin. And for those who just joined, I'm Fred Garcia. Be advised that our session today is being recorded. Let's begin with foundational principles of crisis response. One of the core capabilities that is essential in crisis management is to recognize that crises follow predictable patterns, that crises follow patterns in terms of how human beings behave under stress. Crises follow patterns in terms of how organizations respond to crises under stress. And there are also patterns that help us understand what works and what doesn't work. And patterns have two particular kinds of power. They have explanatory power to help us make sense of crises that happened in the past. And they also have predictive power that help us predict what is going to happen next. And having real clarity about the patterns we recognize can help us anticipate what is likely to happen next, because we have awareness of how those patterns played out in the past. Knowing that these crises follow predictable patterns, there are certain things we know never work. And part of the crisis management discipline is to not even attempt to do the things that we know never work. We also know that there are certain things that always work, but all too often, organizations and their leaders get to them after they've done the things that do not work. But if we understand the things that do not work and the things that do work, we can make smarter choices sooner. And we can study these patterns small, but we can also study these patterns big and use the biggest crises to derive the most meaningful lessons that can apply even to smaller crises, even to less severe crises, and even to crises that affect smaller organizations. The study of the patterns is the seminal discipline to be able to predict what will happen next, but crises are themselves predictable. Another of the patterns is we have far more control over the outcome in the crisis than we may initially understand. And one of the ways that we can exercise that control is recognizing the pattern. We can intervene early to prevent that pattern from playing out. So that's a foundational starting point in all crisis management. Here are some of the common patterns that we can recognize. The first is that most harm to an organization, to its competitive position, to its reputation, to its financial condition is self-inflicted harm. Sometimes self-inflicted because the organization itself does something that it should not have done. But whether the crisis itself was caused by the organization in crisis, or the organization is the victim of some kind of crisis, the harm to reputation, to trust and competitive position is almost always self-inflicted, either because the organization and its leaders made poor choices or executed good choices poorly, or more likely failed to make choices at all. Another common pattern is that small steps taken early can have a disproportionately powerful effect on the outcome and can even prevent harm to trust and reputation and competitive position and financial condition, or can diminish that harm so that it does not become franchise threatening. But the longer it takes to make and execute and communicate smart choices, the harder it is to prevent that harm, and the more likely we will be making the situation worse and worse and worse. And the longer it takes, the less likely it is that we'll get through the crisis as successfully as we otherwise would. One of the patterns to note is that bad things happen all the time, even to good people and even to good organizations. And just because something bad happens to an organization doesn't mean that it's a bad organization or that the leaders are bad people. But one of the other patterns we find is that it isn't the severity of the underlying event that determines whether an organization gets through a crisis successfully, but rather it's the timeliness and effectiveness of the response. In other words, it's what we do next that counts. And the reason it's so important to understand patterns is they help us quickly to figure out what we need to do next. But if we fail to do what is needed next, then we end up making the crisis worse and worse for ourselves. And the longer it takes, the harder it becomes to secure a good outcome in the crisis. We define crisis response as a sequenced combination of the things that an organization does plus the things that an organization says. And what the organization does and the organization says need to be aligned with each other. And if we only focus on the say, but don't focus on the do, we may feel better in the moment, but we will make the crisis worse. If we focus only on the do, but don't focus on the say, we may be remediating some of the underlying issues in the crisis, but losing the trust and confidence of those who matter to us because they aren't aware that we're doing those things. But the biggest challenge is when there is misalignment between what we do and what we say. And if we say certain things in the crisis, but we do the opposite, or we do certain things in the crisis and we say the opposite, then that is a signal that something is likely to get worse and worse and worse. And that's one of those places where we can intervene and fix that and create that alignment. It won't necessarily make things better right away, but it may prevent further deterioration in the circumstance. In order to be able to effectively respond in a crisis, we need to be ready for the crisis. And crisis readiness consists of two different categories. The first is what we call mental readiness, which is about temperament and leadership ability and strategic mindsets. And the second is operational readiness, which is about role and process clarity and easy to follow consistent procedures. So in the world of mental readiness, it begins with a strategic mindset that is focused on the outcome we seek. And in a crisis, the outcome we seek is typically the mitigation of the risks that the crisis represents. Excuse me. Mental readiness also grounds its decision-making on the stakeholders who are likely to be affected by the crisis and on their well-being and on their expectations and concerns and desires and fears. And here's the signal mental readiness mindset discipline. And that is for leaders to never make choices in a crisis based on personal preference, but rather for leaders to make choices in a crisis based on the optimal mitigation of the risks in order to protect stakeholders and to protect the competitive position of the organization. When we think of operational readiness, we think of clarity of role, who does what, clarity of process, how do we do it, and then structures out of accountability for both the role and the process. How do we make sure that the people who are supposed to do certain things actually do them and nobody else does? How do we assure that the things that have to be done actually get done the way they're supposed to be done? And the third element of operational readiness is clear procedures that are easy to follow, that are consistently followed. One of the patterns we find is that leaders are judged based on how they handle their biggest challenges. And when leaders follow the principles that I've shared over the last few minutes, they typically get through the crisis better. And it is possible to build positive reputation in a crisis when the leader navigates the organization through the crisis well, but it is also possible for reputations to fall meaningfully. And that's usually because the leaders fail to follow the principles, and in many instances because they made choices based on personal preference. Now, I see that since I began speaking, others have joined this session. Welcome. Delighted you're here. I'm Fred Garcia. Let me make two disclosures. The first is for those who've joined us, we are recording this, and we assume that your continued participation here is assent to have the session recorded with you here. Now let me say something about the gentleman on the screen. If you happen to be a supporter and fan of the 45th President of the United States, it is likely that you will be disappointed in what I'm going to share next. My purpose is not to criticize the individual, but to study the actions of the United States government, which I believe did not follow established best practices in crisis response or even in pandemic control, and to see the profound human consequences of that, and to use this as a big example that we can learn from and that we can apply to leaders of smaller organizations, but that we can apply to leaders to help those leaders make better choices and implement those choices more effectively. But leaders are judged based on how they deal with their biggest challenges. If they rise to the occasion, they lead the organization through the crisis well. If they fail to, they tend to lead the organization to worse outcomes. Inspired leaders rise to the occasion and ignite and inspire their people. Ineffective or malign leaders fail to rise to the challenge and almost always make the situation worse. That is one of the patterns, that leaders that fail to rise to the occasion almost always make situations and outcomes worse. I mentioned at the start that all of the principles that I will be applying in evaluating the response to COVID-19 by the United States government and comparing it to other governments is based on principles that pre-existed the pandemic. And I begin with wisdom from the late former CEO of General Electric, Jack Welch. And after the Hurricane Katrina flooding of New Orleans, Mr. Welch penned an article in the Wall Street Journal in which he laid out the pattern of failed crisis response. And he says it comes in 4 stages. The first stage is denial. The second is containment. He says this is the stage where people, including perfectly capable leaders, try to make the problem disappear, often by giving it to someone else to solve rather than to try to solve it themselves. The third stage in the pattern is what Jack Welch calls shame mongering, in which all parties with a stake in the problem enter into a frantic dance of self-defense, assigning blame and claiming credit. And the fourth stage comes with what he calls blood on the floor. And he said in just about every crisis, a high-profile person pays with his or her job, and sometimes that leader takes a crowd with him or her. I endorse Mr. Welch's observation of this pattern, that this is one of the ways that we can predict what will happen in a crisis when leaders fail to rise to the occasion. And I note that Mr. Welch wrote this 16 years ago, but we can actually use this pattern as a window into the US government's crisis response in the year 2020. So here are the foundational principles of crisis management. Principle number one is that every stakeholder expects the leader of an organization to care that something needs attention, to care that people are at risk of some harm, to care for those people, to care about those people. And organizations that fail to care and fail to demonstrate caring are on a path to making the crisis progressively worse. So the foundational crisis management strategy is in three basic parts. The first is to make a timely demonstration that we care. Now, the demonstration is not merely a statement of concern, but it is the alignment of the things we do that show we care and the things we say that show we care. Second, that demonstration of caring needs to continue. We need to persistently demonstrate that we continue to care, and that demonstration of caring needs to continue for as long as the expectation of caring continues to exist. And as we look, for example, in the corporate world of COVID response, we see many instances of leaders who quickly demonstrated they cared about their people, persistently demonstrating that they continued to care, and that demonstration of caring continued for as long as that expectation continued to exist, and it continues to exist to this day. And if you wish to see a demonstration of such caring, I invite you to Google a statement from a year ago by Arne Sorensen, A-R-N-E Sorensen, then CEO of Marriott International. They are not a client of ours. I'm not promoting a particular hotel chain. But the late Mr. Sorensen, who sadly succumbed to cancer some months ago, was a model of showing compassion and empathy to his employees, and he serves as a role model for corporate leaders. The second foundational principle is to assess and mitigate risks. What is the precise nature of the crisis we have? And the discipline is to not use euphemism and not to try to hide the consequences of the crisis. What are the actual risks that this crisis presents? And then to define our goals in terms of mitigating those risks we can mitigate and finding ways to work around the risks that we cannot mitigate to make it more likely we come out the other side better than we otherwise would. We then consider the options that are available to us to address those risks, and then ultimately to make a choice. And in a crisis, the choice is typically a choice we would not otherwise have wanted to make, but how do we make the less bad choice, the choice that most likely mitigates more of the risks or the more serious risks? And when leaders focus on risk mitigation, they get their organizations through the crisis well, and then they figure out with their teams how to execute the less bad choice. So here the principle is to take risks seriously and to mitigate those risks. So between caring and mitigating risk, leaders that do both of those get through the crisis well. With that, let's begin to examine the COVID-19 pandemic. And there's a very interesting coincidence of the calendar. And that is on the 20th of January of last year, the first confirmed diagnosis of COVID-19 was made in the United States. And simultaneously, the first confirmed diagnosis of COVID-19 was made in the Republic of Korea, what outside of Korea is known as South Korea. And they both had the confirmed diagnosis on the same day, And we have a unique situation in the world of crisis management in that we can use the response of each nation essentially as a laboratory experiment in what happens if we follow the foundational principles of crisis response, and if we don't follow the foundational principles of crisis response. And when we compare the South Korean response to the American response, a number of lessons become clear very, very quickly. The first thing to note is that the government of South Korea and the business community in South Korea took the risks seriously. And they immediately instituted a whole of government response, coordinating all of the elements of influence and power of the Korean nation to protect its citizens from the risk of COVID-19. That included mandatory masking for citizens and residents in South Korea. It included social distancing. It included, through the South Korean Centers for Disease Control, following the guidelines that had been established for pandemic control by the United States Center for Disease Control and Prevention, which is historically the gold standard for pandemic response. It included quarantining people who had been in contact with those who tested positive. That meant having robust contact tracing, and that also meant having robust testing. And Korea immediately went to these best practices response, and they persisted in these best practices response. So here's a good example of taking risks seriously, but also of demonstrating quickly that they care about their people and doing everything they could to continue to care for as long as that expectation of caring continued to exist. And months into the pandemic, the medical news outlet Science Daily examined the Korean response and shared these observations. At the beginning of the pandemic, South Korea had more COVID-19 cases than anywhere in the world outside of China. So the risks that were presented to Korea were significant. The public health methods they employed closely followed those developed by the U.S. Centers for Disease Control and Prevention, which had served as the scientific beacon for such activities worldwide. And South Korea instituted effective containment and mitigation strategies, which they maintained in place until new cases and deaths were practically non-existent. So this is that persistent demonstration of care for as long as the expectation of care continues to exist. Measures such as those employed by South Korea, especially widespread free and rapid point of care testing, meticulous tracing and quarantining of all contacts, as well as masking, distancing, crowd avoidance, and frequent hand and face washing, are likely to be at least as effective and safe as any safe vaccine. And they said this back in the summer of last year. It is more imperative than ever, they argued, that the United States abandon pandemic politics and focus solely on effective public health strategies, which regrettably the United States was not doing in the summer of last year. In December, the Washington Post did a devastating profile comparing South Korea's pandemic response and the United States COVID-19 response, and they described the difference as staggering. And here's a way to understand that difference. On the 4th of December, the Post reported that from Tuesday to Thursday, the United States had recorded more than 8,000 deaths from the disease. It was the deadliest 3-day period on record so far. It was surpassed later in that month, but that was the deadliest 3-day period so far. Now, more than 9 months after the virus was first detected in our country, this 3-day span is even 5% higher than the highest it had been in the spring. The death toll on Thursday of that week alone, says the Post, was 2,753, just in that one day. In South Korea, where the virus was first detected on the same day as in the United States, the COVID-19 death toll is, notice the verb tense, is 536 total since January. And they note that more people have died in the United States over 5 hours on December 3rd than have died of the disease in Korea for the duration of the pandemic. And here's a tangible way to see this difference. And this is the calculation of new cases daily relative to population. But to me, the most powerful indicator of the stark difference between following best practices and not following best practices in crisis response and pandemic control is this chart. And this is the cumulative confirmed death rate per million of people for both countries. And as you can see, the red curve, the more visible curve, is the United States from when the diagnosis first happened until just about a week ago. And the Korean curve is near the very bottom of the chart persistently throughout. And here's a way to think about the difference. In Korea, South Korea, for every million of population, they experience 34 deaths. In the United States, for every million of population, we experienced 1,692 deaths. That is stark. Another way to look at that is in Korea, 1 out of every 32,428 people have died. What is that number in the United States? In the United States, 1 out of every 614 Americans have died of COVID-19 as of April 9th of this year. This is a stark laboratory apples to apples comparison of following best practices of crisis response and not following best practices of crisis response, which leads us to the other part of this experiment, and that is to look at what the United States did during the same time period that Korea was following best practices. We begin with the leader at the top, and we ask a question that was asked many years ago of another president facing, frankly, a less significant crisis, and that is, what did the president know and when did the president know it? And this becomes important because if assessing and mitigating risk is an essential part of crisis response, knowing when the president understood the risk becomes a key consideration in assessing the response by the leader of that organization. And here's what we now know more than a year after the fact from the public record as it has evolved in the last several months. We know that the National Center for Medical Intelligence, which is a unit of the Defense Intelligence Agency, studied what was happening in the outbreak of what was later called COVID-19 in Wuhan, China, and it took what it studied seriously. And that National Center for Medical Intelligence concluded as early as November that what we now know as COVID could be a cataclysmic event. And then it briefed multiple times to its parent agency, the Defense Intelligence Agency, and then to the Pentagon's Joint Staff and then they briefed to the White House. And in the first week in January, this warning that this disease that was just emerging had the capacity to be cataclysmic was included in the president's daily intelligence briefing the first week in January. We also know that at the end of January, the president's national security advisor, Robert O'Brien, told the president that COVID-19 will be, quote, the biggest national security threat you face in your presidency. And in that same Oval Office meeting, the deputy national security advisor, the former Wall Street Journal China reporter, Matt Pottinger, advised the president that he had reached out to his many contacts in China, and he concluded that it's evident that the world faces a health emergency on par with the flu pandemic of 1918, which had killed an estimated 50 million people worldwide. So as early as January of last year, the president was on notice that something potentially extraordinarily severe was likely to take place. The journalist, associate editor of the Washington Post, Bob Woodward, had a series of interviews with the president, and he later described this Oval Office meeting between the National Security Advisor and his deputy and the President of the United States.
And my reporting shows that he knew back in January 28th, when that extraordinary meeting, maybe one of the most extraordinary meetings in the Oval Office I've reported on for about 50 years. And that is when his national security advisor tells him that the virus is going to be the biggest national security threat to your presidency. And then the deputy, Matt Pottinger, who had worked in China for 7 years for the Wall Street Journal, gives specifics about how dangerous this is, how easy it is to be transmitted. And it's extraordinary that at that moment, the man we elected to, I once asked him, what's the job of the president? He said, the job is to protect the people. I agree. I think most people in this country would. And he failed to protect the people. He failed to find a way to tell the truth.
So I played that clip not to beat up on the president, but note that the president is on record with Bob Woodward that his job is to protect the people, and risk mitigation, taking the risks seriously and demonstrating care, is an essential part of that. In early February, about a week after the meeting with the National Security Advisor, the president shares with Bob Woodward what he knew at the time about the disease. And he concluded that among the things the president knew is that the virus is spread through the air and is 5 times more deadly than the flu.
And so what was President Xi saying yesterday?
Well, we were talking mostly about the virus, and I think he's going to have it in good shape, but it's a very tricky situation.
Indeed,
it goes through air, Bob. That's always tougher than the touch. The touch, you don't have to touch things, right? But the air, you just breathe the air, and that's how it's passed. And so that's a very tricky one. That's a very delicate one. It's also more deadly than your strenuous flus. People don't realize we lose 25,000, 30,000 people a year here. Who would ever think that, right?
I know. It's
pretty amazing. And then I say, well, is that the same thing? This is more deadly. This is 5 per, this is 5% versus 1% and less than 1%, so this is deadly stuff.
So the president is on record on February 7th that he knows that the virus is 5 times more deadly than the flu and that it is airborne. And if you are to take risks seriously, you begin to ask, How do we prevent the spread of an airborne deadly disease?
And
2 days after that, I'm sorry, a month after that, the president was attempting to positively contrast the US response to COVID, which at the time had 546 confirmed cases and 22 deaths, with the death toll from the common flu, saying that we are coming out better, even though he knew that COVID was, in his words, 5 times more deadly than even the most strenuous flus. On March 19th, which becomes a critically important day, the president interviews with Bob Woodward and begins by telling him that he recognizes that COVID-19 doesn't merely affect old people, but young people as well.
Now it's turning out it's not just old people, Bob, which is today and yesterday. Some startling facts came out. It's not just older
yeah, exactly.
young people, to plenty of young people.
So
What's going on in
give me.
So it's not just young people. Mr. Woodward then asks, Mr. President, will COVID-19 be the leadership test of your lifetime? And the president responds, no, this will not be the leadership test of my lifetime, but a number of people have called me the wartime president.
Was there a moment in all of this last 2 months where you said to yourself, you know, you're waking up or you're, you know, whatever you're doing and you say, this is the leadership test of a lifetime?
No.
No.
I think it might be, but I don't think that. All I want to do is get it solved. There are many people that said that to me. They said, you're now a wartime president.
Who said that first to you?
Oh, many people have said
Well,
that to
help
me. I don't
me
want
make
to
it,
think about
I'd like to make it concrete.
No, I don't like to sit back and think about that kind of thing.
Why?
I don't have that much time to think about it, Bob. I'm busy as hell.
So from here, from this point on March 19, and we ask, what did the president know and when did he know it? We know that as early as mid-March, he knew the following. He knew that the virus is airborne, contracted through breathing. He knew that it is 5 times more deadly than even the most deadly flus, that even young people can get it. And he said, knowing that, all I want to do is get it solved. So if all you want to do is to get it solved, how would you mitigate the very risks that the president had shared with Bob Woodward? And the answer is to take those risks seriously and to deploy a whole of government response, which he did not do, to require masking, which he not only did not do, but failed to model and even taunted people who would wear masks, to institute social distancing, to follow all US CDC guidelines. And here, not only did the president not follow CDC guidelines, but it is now emerging that political operatives working for and at the White House affirmatively changed CDC guidelines for political reasons and even presumed to edit the scientists' commentary in the weekly mortality and morbidity weekly report, which is the gold standard in public health. Taking those risks seriously would require quarantining people and to establish contact tracing and to establish testing. And although at times the president would talk about these things, none of these became national policy. And even when we shut down work and only essential workers could be out and about, even then the reopening was sooner than CDC guidelines would otherwise have required and done far more cavalierly than CDC guidelines would have required. He did none of those things. And as of March 19, when he said he only wanted it solved, there were 265 confirmed fatalities. That day, he also told Bob Woodward that he was intentionally playing down the risks in the pandemic.
A moment of talking to somebody, going through this with Fauci or somebody who kind of, it caused a pivot in your mind, because it's clear just from what's on the public record that you went through a pivot on this to, oh my God, the gravity is almost inexplicable and unexplainable.
Well, I think, Bob, really, to be honest with you,
Sure, I want you to.
I wanted to always play it down. I still like playing it down.
Yes.
Because I don't want to create a panic.
So the president here with Woodward says the quiet part out loud, and that is, I always wanted to play it down. I still like playing it down. And he justifies it in terms of not wanting to create a panic. Now, if you take those words literally, I myself find them puzzling, because the president had no problem creating panics in other respects through his campaign and his presidency. I've actually authored a book on the president's use of incendiary language that has the effect of creating panic. But as we look at the date, March 19th, and we look at the idea of panic, I think we have a clue about what the president meant there. And that is, the stock market was plummeting and investors were panicking. And the first quarter of 2020 was about to be the worst first quarter in stock market performance since 1987, which was the big crash that affected Wall Street for generations. So here it seems that the president is measuring the reaction of the public based on the stock market reaction rather than public health reaction. We're going to see this becomes a theme in some of the president's commentary to Bob Woodward. On April 5th, the president tells Bob Woodward that the pandemic is a horrible thing, that it moves rapidly and viciously, and that if it gets you, your life is pretty much over. On the 13th, as US fatalities hit 23,000, recall on the 19th of March, 1 month earlier, the fatality rate was 265. So in 1 month, we have the fatality rate, the fatalities increase by nearly 100 times. That ought to be the source of attention. The president tells Woodward, this thing is a killer. If it gets you, you don't have a chance. Woodward says it's a scourge. The president says it's a plague. The same day, April 13th, the president holds a press conference in the White House and says the following.
America is continuing to make critical progress in our war against the virus. Over the weekend, the number of daily new infections remained flat. Nationwide, flat. Hospitalizations are slowing in hotspots like New York, New Jersey, Michigan, and Louisiana. This is clear evidence that our aggressive strategy to combat the virus is working.
So he says on April 13th to the press corps that America is making critical progress in addressing the pandemic, and that our aggressive strategy to combat the virus is working. But we note he was doing none of the things that public health best practices call for in pandemic response, and he was not following best practices of crisis response. The coincidence of April 13th and that tape of Woodward's was brought to the fore in August when that tape was revealed. And here's just a sample of the commentary looking back at April 13th.
It was April 13th, the clip that we just played. That was on a Monday that he was talking to Bob Woodward. What was the day before that? April 12th was Easter. Easter was the date he had circled on the calendar to reopen everything, if you'll remember, and everyone does. I know. We want to be open by Easter. You're going to be in church on Easter. Let's get back. We're going to play baseball. We're going back for Easter. This is the next day. He's calling it the plague. He said it rips you apart. He said this thing is a killer. It's really been stunning over the last week as these Woodward tapes have come out, how to the day you can find President Trump saying something different publicly than he was saying privately.
So here is a compilation of some of the things the president said from the beginning of the pandemic to the end of May and early June in the pandemic. It was not put together by me. It was put together by Now This, but it is a representative sampling. And I want you to notice at the top of the screen, with each statement, it shows the contagion of COVID-19, the number of cases in the United States as these comments are being made.
It will go away. Just stay calm. It will go away. A lot of people think that goes away in April with the heat, as the heat comes in. Typically, that will go away in April. We're in great shape, though. You treat this like a flu. 15 people, and billions of people, 15 people. Yeah. They're getting better, and soon they're all going to be better. Hopefully, it's going to disappear. One day, it's like a miracle. It will disappear. Now the Democrats are politicizing the coronavirus. You know that, right? Coronavirus. And this is their new hoax. So healthy people, if you're healthy, you will probably go through a process and you'll be fine. You take a solid flu vaccine, you don't think that would have an impact or much of an impact on corona? No, probably not.
President, is it safe or appropriate to be holding rallies during a public health crisis like this?
I think it's very safe, yeah. I think it's very safe. Things are going very well, as you see.
Do you believe it's inevitable that the coronavirus will spread across the country? No, I don't think that's inevitable at all.
We have a report today, the global death rate at 3.4%.
Well, I think the 3.4% is really a false number. Now, this is just my hunch. Personally, I would say the number is way under 1%.
At this moment, we think we have it very much in hand. It's going to all work out. Everybody has to be calm. It's all going to work out. It will end. People have to remain calm. Be calm. It's really working out, and a lot of good things are going to happen.
What do you say to Americans who are concerned that you're not taking this seriously enough, and that some of your statements don't match what your health experts are saying?
That's CNN, fake news. This is just a temporary moment of time. We're in great shape compared to other places. We are in really good shape. And 5 million within a month, I doubt we'll need anywhere near that. As of this moment, we have 50 deaths, which is a lot of good decisions were made, or that number could be many times that. But it's something that we have tremendous control of.
And on a scale of 1 to 10, how would you rate your response to this crisis?
I'd rate it at 10. I think we've done a great job. But we're going to defeat the invisible enemy. I think we're going to do it even faster than we thought. And it will be a complete victory. It'll be a total victory. Because people get better. I mean, most people are getting better. Most, by far, the people, you get better.
Is it possible that your impulse to put a positive spin on things may be giving Americans a false sense of hope?
No, I don't think so. Many doctors, and I've read many doctors, they can't believe the great job that we've done. Doing it the way we're doing it is much better. It's really much better. America will again and soon be open for business. Very soon. We're near the end of our historic battle with the invisible enemy. I think it's ridiculous. We don't have to do it. A lot of those states could go back right now, and they probably will. This is going to go away.
Without a vaccine, sir, why do you think the virus will just be gone?
It's going to go. It's going to leave. It's going to be gone. It's going to be eradicated. But with or without a vaccine, it's going to pass. This virus is going to disappear. It's a question of when. This is going to go away without a vaccine. We have met the moment, and we have prevailed. It'll go away at some point. It'll go away. If we stop testing right now, we'd have very few cases, if any. I always say, even without it, it goes away. The numbers are very minuscule compared to what it was. It's dying out. I think that at some point, that's going to sort of just disappear.
So those reassurances that were contrary to fact were part of a bigger pattern that this webinar isn't going to spend a lot of time on. other than to note that the Washington Post reported in July that up to that point in his presidency, the president had made 20,000 false or misleading claims. The Post calculated in July that he was making 23 such claims per day. By October, the Post calculated it was more than 50 per day, and many of those were about the pandemic. In early October, the Cornell Alliance for Science published an investigative report on misinformation about the pandemic. And one of the things that the Cornell Alliance did was warn that what was appearing in the news media, in newspapers, on television, had the potential for causing public health outcomes that were significantly dangerous. They looked only at news stories in the English language between January and the end of May. Of the 38 million English language news stories they studied, 1,100,000 had COVID misinformation in the stories. And of those, 37% directly quoted the president speaking that false or misleading information. And if you looked at the people who in turn quoted the president, the number, the percentage of misinformation in the news that was attributable to the president was fully 50%. 50% of the false statements about COVID-19 that appeared in the news between January and May were spoken by the President of the United States. And they analyzed the percentage of thematic topic that was in that misinformation. The biggest was about miracle cures, about the president's promoting hydroxychloroquine, about the president speculating about injecting disinfectants into the body or finding some way to put ultraviolet light into the body. The second most prevalent was about the deep state and how COVID was a conspiracy by the so-called deep state to hobble the president. The third was that it was a Democratic Party hoax. And then smaller down, that it was Dr. Fauci just trying to grandstand, or that it was somehow related to people eating soup made of infected bats in China. Just a little part of the racist commentary that was part of that misinformation. Why does this matter? The Cornell Alliance for Science was sounding the alarm, saying that this kind of thing is significant because if people are misled by unscientific and unsubstantiated claims, they would be far less likely to observe official guidance and thus spread the disease, thus risk spreading the disease further. First of all, they would not take precautions on their own. And second, they would transmit the disease to other people as a direct consequence of misinformation. We see that as what actually played out in the United States. Now, on the 14th of August, Bob Woodward's book, Fear, became public. And the interviews that Mr. Woodward conducted with President Trump, which were on the record recorded interviews, became public. And in the course of that, Woodward shared a tape where he was telling the president just a week or two earlier that the book was about to come out and that it would be tough on Trump. Trump says that the United States reaction to the pandemic was among the best in the world. And he justifies that by pointing to the stock market recovery from its lows in the first quarter.
It's a tough book, sir, and you have your say, and there's going to be a lot of controversy about it. I expect the whole business with the COVID and dealing with that is laid out, and so it's close to the bone, and you helped me get there, and I appreciate that.
All right. Well, we've done better than most countries with COVID. You're starting to see that.
I mean, there are parts of the book you're not going to like, and
Not one I like, though.
well, Just, there is, it's tough times. The virus, as you repeatedly told me, and as you've said publicly, it's derailed things, and it's a big reality in people's lives, as you know. So I will get it to you, and
the market's coming back very strong. You do know that.
yes, of course, and
Did you cover that in the book?
yeah, oh, sure.
The other thing that the president says to Bob Woodward in this interview is he says that there is nothing more that he could have done about COVID-19.
It's going to be a contest between you and Biden. It's going to be a contest between both of you and the virus. The virus is set because it's in real people's lives. All those tens of millions of people who don't have jobs, who don't have that income. Listen, I mean, you and I.
Nothing more could have been done. Nothing more could have been done.
Well,
I acted early.
This will be the history that we start the first draft of, and it will continue. And
so you think the virus totally supersedes the economy?
Oh, sure, but they're related, as you know.
A little bit, yeah.
Oh, little bit. I mean,
more than a little bit, but the economy is doing. Look, we're close to a new stock market record.
What I want to hold up here is the president saying there's nothing more that could have been done. And it is essentially from here on that he doesn't engage in the ways to prevent pandemic transmission. And he doubles down on public events without masking and without social distancing. So to be clear, in mid-August, the president understands that the virus is spread in the air, that you catch it by breathing it, that young people can get it, that it's far deadlier than the flu, that it is easily transmissible, that it moves rapidly and viciously, that it's a plague, and that if it gets you, your life is pretty much over. It rips you apart. But publicly, he was saying none of those things. And on the 11th of September, and I am a little taken aback by the calendar item here, but on the 11th of September, the president addresses a rally in Michigan where there is no social distancing and most of the people at the rally are not wearing masks. And I want you to notice that when CNN asks the attendees repeat the misinformation that the president had been saying for months.
Because there's no COVID. It's a fake pandemic created to destroy the United States of America.
But the president said to Bob Woodward that there is a virus, the coronavirus, and that it is deadly.
That's his opinion. The truth is that the CDC said that only less than 10,000 people die from COVID. The other 190,000 have 2.6 or 2.8 other mortalities.
Does it worry you guys at all to be in this crowded space with all these?
I'm not afraid. The good Lord takes care of me. If I die, I die. We got to get this country moving. Can't. What are you going to do? Wear masks and stay inside for another year? Huh? Where'll that get us?
So the people at the rally are acting on the misinformation. These rallies in turn were labeled, including by Dr. Fauci, super spreader events that transmitted the virus. At this moment on September 11th, there were 200,000 fatalities in the United States. On October 3rd, the president addressed a different rally in Ohio, in the course of which he says that COVID affects mostly the elderly with heart problems, and he says it affects virtually nobody. And here is his commentary.
On November 3rd, Ohio will decide whether we end the pandemic and return to record prosperity, or whether we allow sleepy Joe Biden and his group of incompetents to delay the vaccine, shut down the country. He actually suggested that he would shut down the country. We now know the disease. We didn't know it. Now we know it. It affects elderly people with heart problems and other problems. If they have other problems, that's what it really affects. That's it. You know, in some states, thousands of people, nobody young, below the age of 18, like nobody. They have a strong immune system. Who knows? You take your hat off to the young because they have a hell of an immune system, but it affects virtually nobody. It's an amazing thing. By the way, open your schools. Everybody open your schools.
In the third week of October, Columbia University's National Center for Disaster Preparedness published an assessment of the United States response to COVID-19, and they conclude that of the 217,000 US deaths that had taken place between January and October, between 130,000 and 210,000 of those deaths would have been prevented if the United States had adopted the same basic precautions as nations like South Korea and other industrialized democracies had done. In their report, they say that the report examines the staggering and disproportionate nature of COVID fatalities in the United States, which now ranks first in the world, to estimate how many of the deaths were avoidable, with more than 217,000 lives lost at that point, and a proportional mortality rate twice that of neighboring Canada, and more than 50 times that of Japan, which has a much older population. The United States has turned a global crisis into a devastating tragedy. And through a comparative analysis and applying proportional mortality rates, we estimate that at least 130,000 and as many as 210 out of 217,000 fatalities could have been avoided with earlier policy interventions and more robust federal coordination and leadership. And here's just a snapshot of the United States compared to other nations. Here is their conclusion. By failing to implement the type of response strategies employed in the 6 comparison countries, our analysis shows that the United States may have incurred at least 130,000 avoidable deaths. If the US had followed Canadian policies and protocols, there might have been 85,192 US deaths, making more than 132,500 deaths avoidable. If the US's response had mirrored that of South Korea, which had one of the quickest and most robust interventional strategies, the US might have seen just 2,799, leaving nearly 215,000 deaths avoidable. Their conclusion: why was the US death toll disproportionately high? They point to a delayed response, insufficient testing capacity, lack of mask mandate and guidance, politicization of the pandemic, a leadership vacuum, and failure of top officials to model best practices. Their conclusion that the failure of the federal government to create a rigorous national strategy for testing and tracing, to coordinate basic data collection and coordination among the states, and to recognize the scientific validity of non-medical interventions, simply like face covering and distancing, reflected deeply inadequate national response contrasted with our peer nations. 2 days later, the University of Washington published in the journal Nature Medicine an estimate that 500,000 Americans could die of the virus over the subsequent 4 months, but that if the United States went to 95% of Americans wearing masks consistently in public, fully 130,000 of those deaths could be avoided. So what we are seeing in October is scientific literature by prestigious scientific organizations and universities calling attention to the preventability of COVID deaths if only we take public health measures seriously. In that same week, the president's chief of staff tells Jake Tapper of CNN that the United States is not even going to try to prevent the spread of the disease, but rather focus on treating people once they get sick.
When we start to look at this, here's where we really need to make sure. On your website yesterday, Jake, your website is talking about, well, now we think the spread is coming from small social groups and family groups. First it was large groups, now it's small groups.
It's
now
coming from all sorts of places.
Well, that's exactly the
out of control.
So here's what we have to do. We're not going to control the pandemic. We are going to control the fact that we get vaccines, therapeutics, and other mitigation
Why aren't we going to get
areas
control of the pandemic?
because it is a contagious virus, just like the flu.
Yeah, but why not make efforts to contain it?
Well, we are making efforts to contain it.
By running all over the country, not wearing a mask? That's what the vice president's doing.
We can get into the back and forth. Let me just say this. Is what we need to do is make sure that we have the proper mitigation factors, whether it's therapies or vaccines or treatments, to make sure that people don't die from this. But to suggest that we're going to actually quarantine all of America, lock down our accounts, well, that they are. Joe Biden's saying that. He says lock everybody down. We're going to have a dark winter. We're going to have a dark.
That's what health officials say. That's what health officials say. That it's going to get worse.
No,
we have
Joe Biden's
days.
Jake, let's be honest.
Friday and Saturday.
Let's be honest here. The health officials did not say dark winter. Those were Joe Biden's words.
He was quoting a health official. I think he was quoting William Haseltine.
When we look at the number of cases increasing, what we have to do is make sure that we fight it with therapeutics and vaccines, take proper mitigation factors in terms of social distancing and masks when we can. And when we look at this, well, we're going to defeat it, Jake, because we're Americans. We do that. And this president is leading while Joe Biden is sitting there suggesting that we're going to mandate masks.
The president is holding rallies all over the country.
That's correct.
No masks, no masks required, no distancing. There have already been, according to health officials, contact tracing. There have already been cases of individuals in Minnesota and in Washington, D.C., and in Oklahoma that got the virus at these Trump rallies that Dr. Fauci himself called a super spreader event, the one at the White House.
There's also been
contact tracing, Jake. That is not leading.
There's all been.
The political dissonance here notwithstanding, this is a demonstration that even as scientists and public health experts are saying, please put on a mask, the policy of the United States government is to not encourage mask wearing, but rather to say we're going to focus on what happens when people get sick. One of the ways that the government responded to the pandemic was to push responsibility to individual states. And just as in the case with Korea in the United States, we can use different states as essentially a laboratory experiment to see what works and what doesn't work. So take, for example, two states, South Dakota and Vermont. They are both predominantly rural. They both have an equivalent population. South Dakota had a policy of refusing to mandate the wearing of masks, refusal to impose any shutdowns, even as the pandemic went through surges in March and in the summer, and then later in the fall. Vermont, very similar state in terms of size and in terms of being rural, had statewide masking, distancing, testing, and tracing. South Dakota suffered one of the worst pandemics in the world, and there was a time for several weeks when it had the highest death rate per capita of anywhere in the world. Vermont, on the other hand, had one of the best outcomes in the United States. And here's a way to think about it. In South Dakota, there were 8,000 cases of COVID for every 100,000 of population. In Vermont, there were 500 cases per every 100,000 of population. Here's a really good laboratory comparison of the consequences of not doing masking and distancing and the consequences of doing masking and distancing. And here's what it looks like. The upper curve is South Dakota, the lower curve is Vermont, and this is in the infection rate, and this is in the fatality rate. And I want you to notice it resembles almost identically the Korea versus United States curve. The University of Kansas did similar research on counties in Kansas and found that of the 105 counties in Kansas, only 21 of those had mask mandates. And they noted that in the counties with mask mandates, the infection rate was 1/2 of the counties without mask mandates. In Tennessee, Vanderbilt University looked at hospitals in areas with mask mandates and hospitals in areas without mask mandates. And it found that hospitals which drew a patient population where less than 25% of the patients were in an area with mask mandates, they had a huge increase in hospitalizations, where it was between 25 and 50% of the patients came from counties without a mask mandate. It was lower. Here is what happens when hospitals treated patients from counties with a mask mandate. There was virtually no change in the hospitalization rate and no overcrowding and surging of hospital capacity. We also saw that there were some states that not only didn't enact a mask mandate, there were some states where the governors affirmatively forbade local municipalities to order mask mandates. The Lancet Medical Journal in February looked back at the United States experience in the year 2020. And in Lancet, the researchers concluded that 40% of US COVID-19 deaths were avoidable. And here's their conclusion. Many of the cases and deaths in the United States were avoidable. Instead of galvanizing the US populace to fight the pandemic, President Trump publicly dismissed its threat, even while privately acknowledging it, discouraged action as infection spread, and refused international cooperation. His refusal to develop a national strategy worsened shortages of personal protective equipment and diagnostic tests. The president politicized mask wearing and school reopenings and convened indoor events attended by thousands where masks were discouraged and physical distancing was impossible. I close with the observations published last week by the former head of the COVID task force at the White House, Dr. Birx, and here's her conclusion on the CNN special about the doctors.
When you look at your data now and you think, okay, had we mitigated earlier, had we actually paused earlier and actually done it, how much of an impact do you think that would have made?
Well, I look at it this way. The first time we have an excuse, there were about 100,000 deaths that came from that original surge. All of the rest of them, in my mind, could have been mitigated or decreased substantially if we took the lessons we had learned from that moment. That's what bothers me every day. And that's why I have to be able to process this and understand this, because like you said, in the post-mortem, we have to come out of this and learn how to do it better the next time.
So what are the lessons I suggest we take from this? Again, my purpose was not to attack the president, but to use this as an example writ large of a crisis that affects everybody, where we can see the patterns of consequence based on the application of best practices or not the application of best practices. I go back to the wisdom of the late former CEO of General Electric, Jack Welch, who describes the patterns of effective leadership in a crisis. And he says, one of the marks of good leadership is to dispense with denial quickly and to look into the hard stuff with eyes open. And then he describes the leadership temperament that is most likely to lead to a successful outcome in a crisis. He calls it a forthright, calm, fierce boldness. Here's another lesson that we can take from this. And in this lesson, I point to a quote by the Wall Street Journal Business World columnist Holman Jenkins, who published this more than 20 years ago, describing CEOs, but it has applicability across all forms of organization. And that is that organizations need defenses against their charismatic leaders. Otherwise, such individuals can too readily bully or seduce others into supporting their vainglorious illusions. There didn't seem to be anyone at the White House capable of getting the president to stop what he was doing and take it seriously. One of the things that I call on all of us here and that we advise our clients is that we create structures of accountability where we have agreement on how we make choices in a crisis. And one of the phenomena we note is that those structures make courage less necessary. There is less career consequence to pointing to what we've agreed upon in the past and say, let's do what we agreed upon in the past. So again, the foundational principle of crisis management number one is for the leader to care and to demonstrate caring at the level of corporations, at the level of private business enterprise, at the level of religious denominations, at the level of universities, at the level of all forms of organization. The first principle of leadership is to care for the well-being of the people in your care. The second principle is to take risks seriously and to mitigate those risks. And we do that by defining the crisis precisely without euphemism, by assessing what the actual risks are and recognize that our goal in the crisis is to mitigate those risks and to consider the options available to us and to make the less bad choice, the choice that most likely mitigates the most of those risks or the more serious risks. And then we execute to follow the less bad choice. Thank you for your attention. I realized I continued talking without giving an opportunity for questions. For those who joined the call after we started, be advised that the call is being recorded. I'll invite Katie first to let me know, do we have comments or questions in the chat? I'm happy to take questions. I'm also happy to engage in a more thorough discussion. I also realize we're at the bottom of the hour. I appreciate your presence. I'm happy to stick around if you are.
Comment from Jennifer in the chat. Great session, Fred.
Thank you, Jennifer.
So far.
So let me ask a question of Sunny and Tomoko and Fokella and Anne and Lucy and Jennifer. Not to make this political, but as you think of the lessons in this, and also Valeria, I'm sorry, Valeria. And also as you think about the contrast between leaders who take risk seriously and leaders who don't take risk seriously, whether it's governors of states or mayors of cities or CEOs or other leaders, what is the biggest surprise that you experience? You can type in the chat or you can unmute and just talk with me and your colleagues here. What is the biggest surprise of all of this?
Well, Fred, this is Jennifer. Can you hear me?
Yeah, good to see you.
I'll put my video on. Hang
on.
Yeah,
I didn't mean to ask you to. But.
No, but one of the things that I find so interesting is just, again, not to make it political, but when the president talked about, you know, he was going to be a great wartime president, I feel like there was a failure to recognize that this was really an opportunity for him to do just that.
Yeah, that was the moment where he could have stepped into what Jack Welch called forthright, calm, fierce boldness. let's go. We're in this together. Let's solve this problem. And notice, Jennifer, he had previously told Woodward that he wanted to solve it. He wanted to solve it. But that, I think, was one of the missed opportunities. He had self-declared that he was a wartime president, couldn't name who called him that, but on self-declaring, well, let's behave like a wartime president. And so, Jennifer, what is really interesting to me about what you are observing is he could have easily stepped into leading us through. It's not as if anybody was preventing him. And let me now generalize that observation. At the level of CEOs, at the level of plant managers, at the level of office openings, at the level of how we deal with retail reopening and restaurant reopening, here's an opportunity for people to lean in and find the way to protect their people. As more and more become vaccinated, even though there is still vaccination resistance, we will have more and more opportunities for opening. One of the things that I hope you take away is how science helps us understand, as it gets greater and greater knowledge, what are the things that work and what are the things that don't. And the states in the United States who took the science seriously were the ones that had the better outcomes. The nations who took the science seriously had the better outcomes. So one of my recommendations for leaders in civilian life is take the science seriously as well. Other surprises from Sunny or Tomoko or Fokella or Anne or Lucy or Valeria. Valeria, on my screen, you're up with my team, so I'm not trying to ignore you there. I'm sorry, somebody was speaking.
Yeah. Hi, Professor Garcia. It's Sunny.
Hey, Sunny, how are you?
I'm good. How are you?
So good to see your name and to hear your voice.
Yeah, it's a really great session. Thank you for 1.5 hours. All this knowledge is really great. From what I find very interesting is that when President Trump was talking about the mortality rate or how many deaths has been developed with the COVID-19 going on, it's like to me, he's only talking about numbers, and he failed to realize each number represent a person or a family that's been suffering or have loss. It's, to me, it's just like he doesn't care, showing that he doesn't care, which failed the first principle of crisis management. He didn't even show that he cares.
And Sunny, when you were a student in one of my classes years ago,
yeah,
recall that was the foundational principle of our course.
Mm-hmm.
So that is not a criterion that we invented after COVID. That is a criterion that we have made an operating principle, not only in the work that people in my line of work do, but in the class that you attended at New York University, that the need to care, the need to have and express empathy is a critical leadership discipline in the crisis. Now, I don't mean to compare the two personalities in any way other than to harvest a quote, but Stalin famously said that a single death is a tragedy, but 1 million deaths is a statistic. And I have to confess, the news stopped covering the volume. And now you do see things like Nicole Wallace's Lives Well Lived obituaries once a day, but the magnitude of the human suffering has not been captured in day-to-day reporting the way it was early in the pandemic. So that is another really interesting phenomenon here, is as the death toll got bigger and bigger, even scientists kept saying, hey, we can stop it, we can slow it down. That didn't seem to influence not only the leader at the top, but the rest of the government at the top. And I think that's part of why organizations need defenses against their charismatic leaders.
Just to add on that, on one of his video recording, he even tried to decrease the number just out of his imagination. The number, if I'm not
5% to 1%. Yeah.
Yes, right. That's right. It's just I am out of words.
Thank you, Sunny. So glad you could be with us.
Yeah, thank you again.
Thank you. Someone else.
Okay, it's, let me switch on my camera. I hope you can see me. Hi, this is Anne from South Africa.
Anne, I am so delighted to see you and hear you after being connected for so long on social media.
Yes.
Great.
Yes. And it's quite late at night, so I think we all look a little bit worse for the week that we've been through. Just two observations. I said something in the little chat box there. South Africa, obviously, we had one of the strictest lockdown regimens, level 5 to level 1. We're currently under level 1. And obviously, our university recently had an increase in cases. We are not busy with in-person teaching, and that immediately stopped when we had 115 cases. Okay, as students slowly returned, you could expect that. And obviously, out of an abundance of caution, we stopped any in-person activities. But to make a long story short, with our national strategy, I think that was our saving grace. But we can still say, you know, this pandemic will be with us for the foreseeable future. We don't know how it will pan out. And they are predicting a possible third wave. So one has to keep that in the back of your mind. But from the point of having a National Disaster Management Act, specially created and kicking in for this pandemic, I think that was our saving grace, because it is a criminal offense not to wear a mask in public. And the rule is in retail, no mask, no entry. Sorry to hear about your problems. And obviously there are also these people with medical cases or whatever, but I mean, they are so few and far between. And I don't understand how everything in the American context could be so highly politicized. It just makes absolutely zero sense to a non-American, and I will admit that. Then I have another question. Where is the moral courage of the people that should have advised your top officials? Listen, leave the politics aside. It's about saving lives. That also, you know, for a scholar in communication, and I have a keen interest in political science as well, you sit and you literally shake your head because it makes no rational sense. And then for that, Dr. What's her name for a moment? Now she wants to come back and, you know, I should have perhaps said this and should have. You had an opportunity. Where was your moral courage in those moments? Why did you not say, I'm prepared to stake my job on what I am going to do next? Because now to come back and now to want to almost remedy that, sorry, that's not leadership. That is just lack of moral courage 101. Sorry, that's a mouthful.
Well, that's great, Anne. I'm so delighted you're here. Let me remind those who don't know my full teaching and scholarship range. I have been a professor of ethics at New York University for 33 years, among other things. I am a professor, among other things, of ethics at Columbia University's Graduate School of Engineering, which is all scientists all the time. And when Woodward's tapes came out, I have to confess, I was furious at Woodward and whether he had a duty to warn back in March when he heard the president say, this is what I know, and then was telling the nation the opposite of what he knew and was hobbling the response that the medical and scientific community was promoting. And even to the point when people objected to wearing masks, which in your country is a criminal offense, the president rallied the anti-maskers. And when people in Michigan resisted wearing masks, he tweeted about liberate Michigan, liberate Virginia, and protect the precious Second Amendment, which is the gun amendment. And people took that as a call to take up arms against the governors of those states. And one of them, in Michigan, the militia members following that tweet tried to storm the Capitol unsuccessfully, not like what happened in January, but then they plotted to kidnap and kill the governor. And all of that was prodded by the president. Moving back to your first observation, COVID arose when the United States was already heavily politicized, and where the sides had already decided to honor science or to challenge the validity of science, including on climate change, including on evolution, including on other basic scientific principles. So COVID arrived at precisely the moment where it would have been politicized, because everything else in the United States at the time was politicized. But I agree, the duty to warn that medical professionals have as part of their oath is one that I have to look at with great criticism. I do not believe that they are necessarily as much heroes as sometimes people make them out to be, although I appreciate the argument that I had to be able to stay in the room to contain his worst impulses. And I can only imagine, well, what would have happened if you hadn't contained his worst impulses? And there's one more thing that I want to share regarding your asking, where is the moral courage? In the CNN documentary about the pandemic doctors, that last clip of which is an excerpt of, there was a scene that I just didn't have the time to put into this workshop because it's about a 5-minute scene. But in March, the White House Situation Room was the site of a pandemic war game where public health, Department of Health and Human Services, the Department of the Defense, the Department of Commerce, the Treasury Department, many other departments participated in a war game of what happens in the United States from a public health perspective if we don't do masking, if we do masking, if we don't do distancing, if we do distancing. And ultimately they concluded after the day-long war game that we needed to implement public masking everywhere and social distancing, essentially start to do what Korea was already doing, which was following our own health guidelines. They put together a small group to go and break that news to the president. And they were about to go upstairs into the Oval Office to break that news to the president when a deputy at the CDC held a press conference announcing that the pandemic was worse than we had expected, that it was going badly. The president freaked out and removed her from any public role in pandemic response. And when they saw that, they said, no, he's not going to take this well, and they never delivered that message. I point to that as a moment of moral failure, because there, the leaders of the United States government were aware that the path that the president was putting forward was dangerous, and they just freaked out when he fired or removed from public visibility the number 2 person who was the public spokesperson for the CDC. That's where, when you point to where is the moral courage, it's understandable that individually you may feel more at risk, but when the collective United States government says, here's what we've concluded, that I see as one of the biggest moral failures. But imagine if they had been able to prevail on the president in March. Whether you take the Lancet study or the University of Washington study or the Columbia National Center for Disaster Preparedness, just the magnitude of death and suffering would have been so much lower.
If I may, can I
please
quickly
yeah.
Explain our context as well? You know, in South Africa, if we did not have a sense of humor, we'd be in tears all the time. But our nation has now effectively started referring to any national address by our President Cyril Ramaphosa, as a family meeting. And initially, he got a little bit of a bad rap because his national briefings used to start a little bit late, but people take it very seriously. And an observation is that people are getting a little, fatigued. The information does not land as effectively as it should be. Obviously, we had our own controversies because with the level 5, you could literally go to a pharmacy and a doctor and to buy food. Anything else was closed. Okay, you can imagine the impact of that. There was a ban on cigarettes or tobacco products being sold. So that obviously, came over the borders from elsewhere and sparked a lot of illicit trade and criminal syndicates and whatnot. But the ban on alcohol, obviously that was a big controversial thing, and the minister in charge of the sort of task team or the task force, and you also have to understand her political sort of history, but that's interesting in and of its own. But she defended it by saying, we have an alcoholism problem, which is not quite true, but they wanted to free up emergency beds in ERs. And today there's a study that was published where academics say one thing and people in the ER room said, but we could see that beds were freed up. We didn't have people coming in for violence and what, be knife attacks or other alcohol-related things that would happen over weekends. But what was interesting is that, there is an affinity for how the president speaks. People are getting or suffering from information fatigue. The fact that you have to wear a mask doesn't mean that everybody does wear a mask, and there's a marked difference between rural communities and awareness and whether they really stick to that versus maybe urban areas where I live. And I think one thing that one can take out of this is maybe a long-term study or a multi-nation study to compare statistics on where decisions like these were taken on national level versus at state level or provincial level. Our country consists of 9 provinces, but it would be utter chaos if every province did his or their own thing, or every almost like a governor would do their own thing. You have to have a central command, and isn't that just one of those classic realities of crisis management? There's room for chaos theory, freedom, and flat structures and whatever, not in a crisis. That's where you say rank and file, and there's a book according to which you play this thing, and it's not time for trying to be smarter than the next person. You do what is effective and what is good for a country.
Right.
That's just what I'm wondering about.
And one of the things we heard back in the spring when the president said, I'm just going to leave it to the states now, is to think of the war metaphor, wartime president. Connecticut did not go to war to defeat Hitler. Vermont did not go to war to defeat Hitler, and they didn't have different approaches to how they would defeat Hitler. That the United States went to war and then coordinated with allies, so it was the allies going to war. That when the circumstances are of that level of significance, the unity of action and coordination of action is one of the ways to get through it. And the idea that Connecticut could have its own policy on COVID, and Vermont has separate policy on COVID, and New Hampshire a third policy on COVID, and Massachusetts yet another, and Rhode Island yet another, 5 states that essentially are within 200 miles of each other, completely different policies on COVID. And then you multiply that 10 times for the whole United States, there's just not going to be the same beneficial outcome as if you had a coordinated national strategy. I do want to observe, I'm happy to hang around. I'm happy to do this for as long as we need to, but we've been at it for about 2 hours. Any other thoughts, contributions, including from my own colleagues? Let me invite Valeria. Valeria, you've been watching this attentively because I could see as you were watching. What is the biggest surprise for you in what we've been talking about together now for nearly 2 hours?
I believe that his arrogance and his inability to work with other leaders is what has made everything worse. During times like this is when we should be and join others in solidarity to work together, and like you said, have a national strategy so everyone's on the same page. So everyone is obligated to wear a mask and follow protocol. But every state doing whatever they want, I didn't see that until this day. I don't agree with that. I think that during a national crisis like this is when all world leaders should unite and should come up with a plan so that, you know, you put aside your biases, you put aside your political differences, and you get together and you work together. I mean, if not, when will this be over? So I just think that if we had a different leader, things would be better.
Thanks, Valeria. Other questions, comments, observations, including from my own team, as you reflect on what you've seen, but also the discussion that we've been having. What are some of the things that you might want to highlight or amplify?
I will jump in. You know, one, it is emotionally resonant to witness and relive some of what at least those of us in the United States have been reliving in such a short period of time. But I think the really important thing to note is, one, that this case demonstrates the ways in which these principles work, and that these principles don't just work for governments. Is that we see every day in the work that we do, and as we look at organizations in every industry throughout this country and the world, these same principles apply throughout. And if we know that and are mindful of that, then we can be ready to respond whenever something happens. And all of us are still going through this. All of us are still needing to respond to what's going on with COVID-19. And so these principles can help us as we start to think about what comes next.
And thank you for that, Katie, and thank you for holding that up. And one of the things that I'll remind us was something I said early in the workshop, and that is patterns have both explanatory power and predictive power. And one of the reasons to look at a crisis this big is it helps us see the patterns more clearly, looking back and seeing, now I understand how that happened, even if it horrifies me. That helps us in the future recognize that pattern early and be able to take steps to intervene. Even if the pattern is we need to create a circumstance where people can exercise their duty to warn when there's a need to warn people about some horrific decision that is about to be executed. How do we create those structures that are the defenses against the charismatic leaders that the Wall Street Journal columnist Holman Jenkins wrote about 23 years ago? That pattern continues to have relevance as we look backwards at COVID 2020 and forward into COVID into 2021 as the reopening begins, as the vaccinations reach some form of critical mass. How will we then adapt to the new health environment and not over open and overcorrect in ways that put us right back into some kind of difficulty?
When you mentioned patterns, now this is on the slightly negative side, our vaccination rollout is not so much a rollout as a when will it happen. And it was hugely controversial to get hold of the vaccines and the money being spent or misspent. And it's no secret that our government has a long history of misappropriation of funds. That's a euphemism, right? And there things do get politicized. Now that is now our issue, which complicates things. But they seem to be getting it off the ground with healthcare workers, but not nearly the numbers that you have in the US. So I think thumbs up and congratulations to US for getting that right. That's definitely a step in the right direction and a corrective step. I think unlike or on a scale which we have not really seen in other circumstances. We also do have our fair share of vaccination hesitance and, people believing a lot of the misinformation that comes or came from the US. And to say that President Trump or former President Trump had his fair share or has his fair share of South African fans, that is an understatement. But it is interesting to see how many of the arguments and lines of thinking became global lines of thinking, which actually makes it for interesting research on the topic. I don't have nearly enough time in every day to think of all the things that I would like to follow up in terms of research, but there's material for years to come that we can do research on as communication scholars.
Thanks, Anne. We're coming up on the 2-hour mark, and I'm going to invite Katie to close us out. Let me thank you all for your attendance, for your participation, for staying through a half hour longer than the scheduled time. I deeply appreciate that. I invite you to be in direct connection with me and with our firm. I'm so pleased to see some of you for the first time and some of you for the second, third, or 15th time. I'm so glad that you could be here. Katie, I hand back to you to take us out.
Thank you, Fred, and thank you as well. I will echo what Fred just said. Thank you to all of you for being here and for staying longer and engaging in such a wonderful discussion. For those who are new to the Logos Learning Center, thank you for trying us out and being part of this class for the first time. In case you don't know, the goal of our Logos Learning Center is to bolster the leadership skills of those who hope to ignite and inspire others to create positive change in the world. And I hope that this webinar gave you some more insight so that you can go out and do that work. I encourage you to look at some of the other classes that we offer. We will be posting more classes that we were offering for the next month. But if there's anything that is of interest to you that you think can help you as you engage in your work, please consider enrolling in that class or contacting us, and we can help you to figure out how we might be able to help through the Logos Learning Center. As you will have seen in the chat, I let you know that, although now you probably already have received, because we're a little bit over, an email inviting you to continue to connect with us, as well as to fill out a survey to give us feedback on how we can do better, and also to give us any thoughts or feedback you have for us. And finally, I encourage you that if you really enjoyed this class, if you found it valuable to you to not only fill out that survey, but please leave a review. You can do that on Google Business. I'll ask one of my colleagues to drop that link into our chat. And we are just so appreciative of any feedback and thoughts you have on how we can continue to help serve you and move forward in our mission. So with that, thank you.
Thank you, Katie. Thank you to the rest of the Logos team, and thank all of you for investing your time and being with us today.